Hello, listeners. This is Yukta speaking, your host for today's episode, which is the talk given by Shraddha Mittal, Implementation Associate CARPL, on the topic Deploying Challenges for Real World AI Solutions in Clinical Workflows. This talk is a part of the 12th IC Innovator Club virtual meeting hosted on the topic What It Takes to Do Real World AI Lessons from Deployment. Let us hear from Shraddha Mittal.
Thank you, Sachin. Thank you, Dr. Shetyan, for such a comprehensive speech on how you are trying to develop very highly accurate AI solutions. So, hi everyone. So, in interest of time, I think I'll spend next 10 minutes, discussing while there are such amazing AI solutions developed by Synapse, the spine MR solution, and Cures. Chest X-ray and head CT solutions. While the AI development life cycle was very comprehensively covered by both Dr. Shetyan and Rohit, I would like to address a few challenges and throw light on what are the challenges that we face on a daily basis when it comes to deploying these AI solutions in real world clinical workflow. So, as Sachin just mentioned, at CARPL.ai, we are working towards serving as a single enablement layer that allows healthcare providers access to the best AI in medical imaging solutions worldwide, and also ensuring seamless integration of these AI solutions into their day-to-day imaging workflow. So, Dr. Shetyan's Synapse solution and Rohit's the chest X-ray solution, we have we have these solutions already integrated on Apple, and we are in fact in the process of deploying these solutions across our partner hospital sites worldwide. So CARPL is deployed at multiple locations across different continents. We are deployed at academic centers in the US, at Thomas Jefferson University. We are working with the Stanford Amy Center. We are also very actively working with Mass General Hospitals and other locations in the US. In Brazil, also, we are very actively deployed at Albert Einstein Hospital, 3D and DASA diagnostic chains. And right now, we are also deploying our solutions, our solutions, if I may say so, at IMED in Australia, along with other imaging centers worldwide. So in India, of course, we are deployed at Manipal hospitals and Mahajan diagnostic chain. And we are constantly on the lookout for more healthcare providers to collaborate with. So yes, I think I quickly highlight what are the key challenges that CARPL addresses. So basically, long story short, we know that there are multiple AI solutions out there in the market, right? And they are all equally good. And but the key challenge when it comes to deploying these solutions is that healthcare providers do not know the existence of these AI solutions, and B, they do not know how to access and adopt these AI solutions into their day-to-day workflows. So these are the two main challenges that we at CARPL are precisely trying to address. And this is a daily, this is precisely what our objective is, and this is what all our energy and efforts go into. So I'll tell you a quick what is the life cycle that CARPL tries to follow when it comes to successfully deploying AI solutions into medical imaging workflows at hospitals, and how is it that we are trying to add value to both AI developers and healthcare providers in this entire ecosystem. So as I'm sure everybody is already aware that one major challenge when it comes to deploying an AI solution into hospital ecosystem is the IT infrastructure that one needs to get past. So from our experience over the past year, there are multiple levels of review that an AI solution or a software vendor will have to go through before they can even run a POC to deploy and test their AI solution live at a hospital site. So we at CARPL tend to cut this entire timeline, and we our collaboration with AI partners is such that we would want them to focus on integrating their solution onto the corporate platform, and that also we try to facilitate as quickly as possible. It is ideally a single point integration, and it does not it can take from maybe 16 to 24 hours to integrate maybe Synaptica's spindle lumbar spine MR solution into CARPL. And then from that point onwards, it is our job to take that solution to as many hospital sites across the world. So exactly from this point onwards, we will facilitate integration of that AI solution into a hospital. We will figure out what is the right IT setup that we need to get past. If there is any security review that we need to go through. And so basically, what CARPL does is it allows AI developers to basically focus on developing more robust solutions, and the deployment aspect of taking those solutions from bench to clinic is CARPL's. So we are basically acting as the enablement layer, and we would want the hospitals to have access to as many robust AI solutions out there in the market, and vice versa. We would also want the AI companies to have access to as many hospital sites across the world to deploy their solutions and get real world feedback as to how they are performing and where are the white spaces. So yes, I think that is pretty much about what CARPL does. And I think uh, a few more things that we are currently working on, which we are also learning in real time, is that how CARPL can also serve as a single interface to give feedback from the clinical world to AI developers, and kind of frame that path of gathering real-time feedback, and that could serve as very valuable data for AI developers to further build upon some more features, and incorporate those inputs from doctors from their day-to-day interactions with these AI solutions. So yes, I think that is pretty much what CARPL is currently focused on. When it comes to onboarding AI solutions, as Sachin had mentioned, yes, absolutely, Sachin, we are constantly on a lookout for solutions with high accuracy, uh, preferably solutions with FDA and CE approvals. Having said that, it is not a prerequisite to come on CARPL, because that is also one area that we assist AI companies with. So we help AI companies run clinical trials for FDA approvals and CE approvals. So that is a different vertical that CARPL helps AI companies with. So we have helped we have helped some chest X-ray companies in the past to get FDA approvals, and there are multiple clinical trials that are currently underway. Uh, so yes, CARPL can serve again as a single point interface for any AI company to get those regulatory approvals. So as it's not a simple task. It's not a day's task. It requires multiple resources, and it requires a platform where ground truthers can do annotations, where data can be collated, and you require domain expertise. So all of these aspects are once again taken care of by CARPL. And so we try and run both pilot and pivotal studies for AI companies to get FDA and CE approvals. In fact, now we are also beginning to work for TGA approvals and LG PD approvals for Australia and Brazil respectively. So that is how we are constantly expanding into that domain along with ensuring that these AI solutions are deployed across all of our partner hospital sites. So yes, I think that is what our ultimate focus is.
Thank you, Shraddha Mittal. To watch the complete club meeting on this topic, visit the link in the description below. Subscribe to the channel to get instant access to all the podcasts. Follow us on social media through the links available in the description below. Thank you all for spending your time in listening to this week's podcast. Look out for a new episode every Wednesday, published on Google Podcast, Spotify, and Apple Podcast. If you are interested in hosting your podcast with us, fill the form available in the description below. Thank you once again. See you next time.